We have two presenters today. We have Kristen Minkevich.
Yeah, there you go.
Oh my goodness, I practiced that. I thought I could get it. Kristen Minkevich and Noreen Corpel. And I'm going to introduce both of them right off the bat, and they're going to be up here co-presenting. Kristen received her Doctor of Physical Therapy degree from St. Ambrose University in 2016. She worked on the Mary Greeley Medical Center Acute Rehab Unit for 4 years and has been working as a home health physical therapist for Mary Greeley since 2021. She is a certified brain injury specialist and a certified OASIS specialist clinical. She is passionate about reducing falls, especially in older adults and adults with neurological conditions. And with her will be Noreen. Noreen received her Master's of Occupational Therapy from the University of Wisconsin-Madison in 2017. She has experience in skilled nursing prior to starting with Mary Greeley Home Health in 2020. She has a passion for working with older adults and helping them be successful at home. Please welcome Kristen and Noreen.
Hello, like Vicki said, I'm Kristen. And
I'm Noreen.
Thanks for coming today. We're going to talk today briefly about fall prevention. I assisted in a presentation a few months ago that the primary focus was fall prevention. But today, the heart of the presentation is really talking about home modifications to reduce fall risk, which was different than the spin we had last time. And then briefly discuss how to get off the floor in the case of a fall as well. So the importance of what we're talking about today, in the United States, about 1 in 4 adults aged 65 and older report falling each year. About 37% of those, so a little over a third who fall, do report an injury that then requires medical treatment or restricts activity for at least a day. And falls are costly, $50 billion on medical costs related to non-fatal fall injuries. And then unfortunately, close to $1 million spent related to fatal falls. So, I mean, people can die from falling. So anything we can do to help prevent that is important. The map just shows by region where falls tend to be the most prevalent. I don't exactly know why the South is a little more prevalent than the Midwest, but Midwest, we're right in the middle, so.
All right, audience participation. What do you guys think are some causes of falls?
Poor lighting.
Yeah, definitely poor lighting.
And rugs.
Yeah, tripping over rugs for sure. Dizziness. So as you guys are, what was that? Trifocals, glasses, yes, maybe related to the dizziness. So what you guys are kind of hitting on is we can break down the causes of falls into intrinsic or internal factors and extrinsic environmental factors. So those intrinsic factors are things that sometimes we can help and sometimes we can't. So things like advanced age, nothing we can do about that. Previous falls, muscle weakness is something we can do something about. Gait and balance problems, that's where PT, OT comes in. Vision, postural hypotension or orthostatic hypotension. That's when you stand up and your blood pressure plummets, which can make you dizzy and lead to a fall. Chronic conditions, arthritis, diabetes, stroke, Parkinson's, incontinence even. Also fear of falling, anxiety. That fear of falling can make you overly cautious and can almost make it worse when you do get into a situation where you're about to have a fall. And then those extrinsic factors is a little more what we're going to talk about today with the home modification. These are things that we can do something about in order to prevent falls. So handrails on the stairs, poor stair design. Have you guys seen those like carpets on stairs that you can't tell where one stops and another one starts? Grab bars in the bathroom. Someone mentioned lighting. Someone else mentioned throw rugs, tripping hazards, slippery or uneven surfaces. Medications, too, can make us dizzy or make you fatigued, which can also cause a fall. And then not using your assistive device, so walker, cane, four-wheeled walker, not using your device properly or forgetting to use your device. Oh, yes. Okay. And so today we kind of broke it down by area of the home, and then we have like a general section too. So we'll kind of be going back and forth on which area of the home and what things we can do to help prevent falls.
So as far as the entrance or the exterior of the home, having railings for the steps can be helpful. A slightly more affordable option to railings and maybe an easier to install option might be a grab bar. For grab bars, I really do prefer more of an extended grab bar. You can Google search or search on Amazon for like a RV extended grab bar, and you'll get something like the picture shows. I recommend that because that helps you to be able to go down the stairs forward and keep your grip the whole way. Whereas if you think about if the grab bar is just there and closer to the wall, that kind of forces people to go backwards down the stairs. So yeah, I like the extended because it helps you be able to go down forward. Sometimes it might be preferable to have a wide step that can accommodate the size of a walker, that can allow the transportation of the walker up and down the stairs without, kind of having to get it over several stairs at once. Wheelchair ramps if needed. The general recommendation on ramps is 1 inch of rise for 1 foot of ramp. You may consider removing a storm door or the screen door if needed, if it's getting in the way. Obviously, if your walkway is uneven, has a lot of holes, thinking about repairing that. And then as we come into the winter, thinking about salt, sand to melt ice, increase traction, just having a general mindfulness of the weather, maybe if it's a really icy, slick day, if there's something that can be delayed, deciding to delay that errand instead of risking it. Or they make these things called yak tracks. Some of you are probably familiar with them, but they're kind of these metal attachments to the bottom of your shoes, and they can help increase traction in the winter as well.
Okay, going into the bathroom, I have a whole bunch of slides, so bear with me on this. So the first one we're going to talk about is in the shower grab bars. So a lot of people will ask, which do we prefer in terms of suction versus a wall-mounted grab bar? In general, if you can do a wall-mounted grab bar and you have the studs, of course, that's going to be a little more stable. But if you don't have like a studs in the wall or financially can't do it, the suction ones are not a bad option. You just need to consider how much support you need. The suction grab bars are okay if you're a person that just kind of needs that touch assist when you're going in and out. But if you're someone that's looking to like yank and pull up on the wall, then that's when you would want to get a more stable grab bar mounted in the wall. In terms of the height and whether it should be vertical or horizontal or diagonal, there's not really like a set prescriptive way that we recommend. It really depends on the person, on their own shower setup, and what feels comfortable to you. So what I tell people is sit in the shower and consider, where do I want to reach right now to stand up? Kind of picturing that, that's where you put your grab bar. Most people tend to like the vertical one right in front of them and maybe a horizontal one right along the wall. But again, it's really kind of up to you and what you're looking for when you're feeling your way in and out of the shower. Seated shower options. So as you get older, definitely worth it to consider if a seated shower might just be safer than taking a standing shower. There's all kinds of options to consider. There's ones with backs, without backs, yes to armrests, no to armrests. And these fit in a lot smaller of shower stalls than people often realize. I have people tell me like, oh, that's never going to fit. And then I bring one from the office and they're like, oh, it does fit. So especially like the third one I have there, that teeny little stool, those can fit in a pretty small space. And then I just included where to buy them, really any medical supply store, or you can even see these in like the home health section of like Walgreens or Walmart. I do love Amazon because it's so easy. And I included a bunch of links to the equipment I recommend most often at the end of the presentation. So if anybody has questions about that, I'm happy to help. Tub transfer bench. So contrary to popular belief, you can still take a shower in your bathtub, but you can use something that's called a tub transfer bench. So I included this picture because it kind of shows that 2 legs go in the tub and then 2 legs go out of the tub. So rather than stepping over the tub, I'm going to demonstrate, and I'll try to stay on camera. You would sit down and then swing your legs in while you're seated. You would sit down and then swing your legs in while you're seated. So it kind of eliminates that fall risk of stepping over that high tub while, it eliminates that fall risk of stepping over the tub. Something I recently saw that I've never seen before is someone who modified their tub to take a little cutout of it so that they didn't have to step over. So not everybody is that like handy around the house. So this is actually a pretty affordable option too. They're right around like $50, and no, insurance typically does not cover it, unfortunately. All right, general considerations. A handheld shower head can be a really easy option too because it helps you keep that spray from getting everywhere. And while you're seated, it gives you the ability to shower and rinse off with a little more control over your water. If you are going to have a non-slip mat outside the shower, make sure it has rubber on the bottom of it, and don't ever use towels. You can use towels to dry off the floor before you come out, but don't step on that towel because that's definitely a frequent way that people fall. They're not meant to be used like that. Or another good option is these non-slip strips. They come in almost like a tape roll, and you can just cut them and then put them down, and you can put them in the tub, you can put them outside the tub, and it just adds a little bit of extra texture for you to help prevent falls more. Onto the toilet. So the standard height of a toilet is about 16 inches, which off the top of your head is actually pretty low, like that tall. So ADA recommendations are like 17 to 19 inches. So a lot of options you have rather than just buying a new toilet, which is also an option. They have these elevated toilet seats. So just like with the shower chairs, you can get one without armrests. You can get one with armrests. You can get just the armrests. You can get armrests that go all the way to the floor. There's kind of a plethora of options. And again, the best thing for each person really depends on what your shower or what your bathroom setup looks like. So for someone with like a really tiny bathroom that's using a walker, I probably wouldn't recommend the one where the armrests go all the way down to the floor because you're not really going to have room to maneuver. These little toilet risers that sit on the toilet sometimes can be wobbly, but if they're a good fit on your toilet and you screw it in, it's very stable and safe. So again, it just really depends on your own bathroom setup and your own comfort with your toilet seat. The armrests are often a good option just because that extra oomph to push up can make all the difference in the world in maintaining your balance. The other option too is if you already have a commode, that commode can sometimes just fit right over the toilet. And they make these little things called splash guards, and it looks like a little donut that you can slip right in there, and then that eliminates the gap between the seat and the toilet so that you don't make a mess. Other general bathroom things to consider is at night, having a night light or a motion sensor light in between your bedroom and the bathroom. We talked earlier about how sometimes falls are caused by not having enough lighting. And since that's a pretty common pathway, bedroom to bathroom, making sure that you have consistent lighting, especially at night. Never rush. It is better to clean up an accident than it is to clean yourself up off the floor. And a good way to not rush too is maybe timing your toileting to go to the bathroom either before you think you need it, or make sure you go that one last time before you go to bed, just to eliminate that need for rushing. Depending on how often you're going at night and how dizzy you feel when you're getting up at night or how groggy, you could even consider just having a commode or a urinal in your room overnight to eliminate the need of going all the way to the bathroom and then all the way back. Another thing to think about is consider the width of the bathroom door, especially if you're using a walker or a wheelchair, making sure that you have enough room to get in and out. And some things I've recommended to people before is even removing the door. If your wheelchair or walker can get in through there with that little bit of extra space and you're the only one at home, like you could consider putting up a curtain. Or I've had people that put in sliding doors to their bathroom, just because when you're using big equipment like the walker or the wheelchair, those extra inches do matter. Oh yeah, and then consider the timing of your medications too. So what I really mean by that is like Lasix or water pills, you're probably not going to want to take that right before you go to bed because you're probably going to wake up and have to go to the bathroom. But of course, follow your doctor recommendations. I'm not your doctor. So, okay. And then I think I'm also talking about the kitchen. I swear Kristen will talk eventually.
I will.
All right. In the kitchen, generally, I tell people to keep their most frequently used items between waist to shoulder height. I know a lot of people really like to keep a tidy home, but if you have something like the same coffee mug or I use the same bread or something like that, consider just leaving it out. Or for example, like your Instant Pot or your crock pot. If you cook with it all the time, consider compromising and just leaving it out on the counter where it's easier to reach and you're not putting it down and picking it back up, because it's those little things that you're not thinking of and not paying attention to that can cause the falls. Just like with everything else, good lighting, removing throw rugs. If you are someone who likes to have a rug in front of the sink, make sure that it has the rubber bottom, and you can even tape down the edges of the rug with like duct tape to make sure that your foot or your walker is not going to catch on it. Consider somewhere to sit if you're going to prepare meals or be standing for a long time. We tell people to sit down before you think you need to. So even if you've been standing for a few minutes and you're like, I could probably chop one more onion, sit for like a minute and then get up and you'll feel a lot better and not push it to the last minute, risking a fall. So this lady is sitting in her walker, which is a nice option. For those of you that have the walkers with the seat in it, just putting it behind you and having it there. Consider using lighter items. So a gallon of milk weighs 8 pounds. It's actually pretty heavy. So consider switching to things like a half gallon of milk versus a full gallon, or individual water bottles. Even if you have like family or someone help you portion out things so that they become lighter. And that actually goes for things like laundry as well. Consider switching to like laundry pods versus like a big laundry detergent, just again to make it a little bit easier to carry things and eliminate the balance challenge that adds to you. And then if something is falling, let it fall. I can't tell you the number of people I've had who had a fall because they were trying to catch something. It is easier to pick up whatever you dropped than it is to get yourself off the floor. Oh yeah, and don't walk away from your walker in the kitchen. That's the other thing. Make sure that if you're using the counter for balance, you have a path back to your walker or your cane or whatever you were using. Don't risk stranding yourself. I think this is still me. It is still me. All right, here are some examples of walker trays that you can use to carry things. So I've seen people try to carry things like in one hand while gripping the walker. It gets kind of tricky, so you can consider walker trays. So the one on the far side is just placed right over the top of the walker, and the one closer to me is a foldable tray. So you can fold down the front so it doesn't take up quite as much room, and then when you're ready to use it, you can pop it open. Both work pretty well, and it's kind of up to you what you prefer. Or you could use the four-wheeled walker seat. Or even a walker bag can work if you like have a cap on your water or something to carry things back and forth. And you can also use the counter to carry or move heavy things. So if you're someone that has like a long counter, fill your cup of water, move it, walk, 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 grab it, move it, kind of like leapfrogging your way over to avoid carrying something with you. And then because I'm an OT, I couldn't resist. adding just some kitchen adaptations for our friends with arthritis and issues with your hands. There are so many things that you can have that makes your life easier in terms of like adapted cutting boards, adapted rocker knives. That dice them on the end is a little sticky to help you open things. So just a bunch of easy ways to make your life a little bit easier in the kitchen. I don't know how much it relates to falls, but like I said, I'm an OT and I couldn't help myself.
All right, the bedroom. We kind of talked, at night with the bathroom, same with the bedroom, considering a night light or some sort of switch close to the bed. Vision is so important as related to falls. It's one of the 3 senses that really helps with your balance. So nightlight, keeping a phone near the bed in case you need help, or forbid that you were to have a fall, you would have the phone in there. Keeping clear pathways, making sure clothes, clutter is off the floor so you don't trip on that overnight. Having a bedside table that's clear of clutter with the items you use the most, easy to reach, and maybe having a reacher at the bedside to reach some of those items that are further away. To get in and out of bed and help prevent falls, with that component, there's multiple bedside railing options. You can have ones that don't touch the floor and just kind of sit there at the head of the bed, or ones that do touch the floor. These can help provide leverage with especially the motion of laying down and sitting back up. Or they also make these transfer poles to accomplish something similar, just a handhold to help you get out of bed and back into the bed. Stairs inside the home, thinking about having handrails on both sides if possible. Obviously, they shouldn't be loose, they shouldn't be broken. They should extend the whole length of the stairs, which also sounds obvious, but I have seen plenty that cut out early. Just having well-lit stairs. It's nice if you can have a light switch at the top and the bottom of the stairs. If you don't, maybe consider hiring an electrician for that project. If light bulbs are burned out, change them. Using good footwear. I think, socks on carpet or socks on linoleum, well, that can be pretty slick. So even inside the house, you might consider a grip sock or wearing a shoe inside even. You can consider texture strips, much like the ones Noreen showed in the bathroom. You can put that at the edge of stairs as well. If the stairs are carpeted, the carpet should be firmly attached. You can also use color contrast to better visualize the edge of each stair, like a different color of tape that's very different from the color of the stair, especially if vision is an issue. Again, no clutter on the stairs. That's just not smart. And if any steps are loose or uneven, well, fixing that. If it gets to the point that stairs are too hard to do, they do make what's called a stair lift. It's operated by electricity, and it's kind of like an amusement park ride almost, I guess. It takes you up and down the stairs just with the power of electricity. I haven't heard much as far as people being able to get these paid for, and it is quite an investment, over $1,000. So it's not typically a decision people make super lightly if they decide to install one. VA might be the one exception to that. If you're a vet and need a stair lift, I think they are willing to reimburse for that. But otherwise, most standard insurance beyond that, this would just be a private investment.
So more general living room, main area things. We keep saying it, but remove the throw rugs, or if you have to have it, consider taping down the edges. If you had $1 for every time we told you to keep your pathways clear, make sure that your frequently used pathways are clear, uncluttered, well lit. Other things to think about are keeping your phone close to you and never rushing to answer the phone. I know for my grandma, we ended up getting her like a little like neck purse that she would keep her phone in, and it also served to make sure she never lost it. I also will tell people every time you get up, make sure it's in your walker bag, things like that, because that way, if you do have a fall or need something else, it's right there. Thinking about wearing an alarm device that will bring help in case you fall and can't get up. So like the life alert kind of thing. And we've gotten pretty fancy with them in terms of what they offer and how you can wear them. I've seen them on the wrist or on the neck. Not a bad option, even if you haven't had a fall before, especially if you live alone, just so that you know you have someone checking in on you if you need it. Keep emergency numbers in large print near each phone. So, you know, like if you need your doctor's number or family members, things like that. Keeping wires away from walking paths, so keep your paths uncluttered. Making sure the chairs and couches are not too low to stand from. So those little things in the corner are furniture risers, and you can put those underneath like couches or chairs or the recliner to make it a little bit taller. And I'm sure some of you probably also have like those easy stand recliners that can provide a little bit of lift assist. Those can be nice too. Just the therapists want you to make sure you don't overly rely on it, because we still want you using your leg muscles, but it's a delicate balance. So if needed, it can be a good option. Be aware of where your pets are when you're walking in the home. Sometimes those pets aren't so good at getting out of our way when we're walking. So if you have pets, just make sure you know where they are, especially, again, at night. And then keeping reachers and grabbers in the home. If you need to reach something to the floor, sometimes it's easier to just use your grabber. And here, there's a lot of options. The one closer to us would be easier for like getting dressed. And then the one on the end, they make them pretty heavy duty. I've seen people use them like in the yard for like pulling weeds and gardening. I think they show too that it can be magnetic. So I had a patient that I showed her she could pick up her bobby pins with her reacher with the magnets, and she loved it. So it can be pretty snazzy. Yeah, there's tons of options in terms of like what kind of grip you want and how long it is. So again, just Walgreens, Walmart, Amazon, it's totally up to you what things you like. But I usually recommend that people have them. I've used mine before in my own home, dropping things like behind the washing machine. So they're just definitely pretty handy.
As far as vehicles and preventing falls in relation to those, it's preferable to, well, much like Noreen, she already did a great demonstration, much like Noreen showed with the tub transfer bench. You sit and then you bring the legs in. Because if you think about it, if you don't have great balance on one leg, well, if you sidestep into a vehicle, then you are balancing on one leg for a moment in time. You can consider lowering the windows if you need extra handholds. But even better than that is looking for handholds that won't move on you, such as the seat itself or the dashboard. I did bring up a picture of what's called a car can, where the door latches. There's a little metal hook. That's where the car cane goes, and that can provide a supportive handhold as you go to sit and as you go to stand up. This is a little individualized, but generally for most people, having the seat all the way back and all the way lowered will give you the most room to maneuver in and out of a vehicle effectively.
All right, low vision modifications. So Kristen already mentioned it with the stairs, but high contrast tape, and that's even like bright pink tape at the edge of stairs and between floor types. So by that we mean if you're going from like hardwood to carpet, sometimes it's hard to see that, and that difference can be just enough to trip you up. So having that brighter alert to let you know when you're going between different floor types. There can also be like 3D buttons for microwaves, placement of lighting to avoid glare. So making sure that the lighting is not directly over you so that it's causing that return glare. There's plenty of things online about like the best lighting and where exactly to place the lighting, and that can also get pretty individualized, but playing around with the location of your lights and what type of lights so that it's giving you the best bang for your buck. Then the other thing is keep things in a consistent spot. So I always put the TV remote in the basket right next to my recliner. I always keep my calendar on the other side, just so that depending on vision, you're not searching around for something. You feel it and you know exactly where it's going to be. There's plenty of other low vision modifications that can get pretty specific to people's homes. So if anyone has any questions, you can ask us later too.
Wanted to talk a little bit about different assistive devices you might use for walking. Again, this is pretty individualized, but I think it's good for your general info to know what's out there. So there's many different kinds of just walkers. So a front-wheeled walker would be more like the metal frame walker with 2 wheels in front. Or then there's also the 4-wheeled walker, which is more with the 4 wheels and brakes. The 2-wheeled walker tends to be more stable than the 4-wheeled walker. People will sometimes say, well, the 4-wheeled walker has brakes, so that makes it more stable. But, well, not really. It has the brakes because it's less stable. With the 4 wheels, it can get away from you a lot quicker than one with just 2 wheels. So for somebody with like a really fresh, like break in their hip or something, really the front-wheeled walker is probably what is going to be recommended to really be able to put the most weight through your arms to take that pressure off the leg. A more recent invention is the up walker. It's like a 4-wheeled walker, but then it has 2 platforms already attached that you can put your whole forearm on. Bad news about the up walker is I haven't heard of people having success getting that reimbursed through insurance. For the other kinds of walkers, every 5 years, insurance will typically pay for a walker if something happens that necessitates the need for a walker. Typically, that requires a prescription from a doctor and then somebody to write a little paragraph letter about why you might need that walker. There's also crutches, canes, many different kinds of canes, single point, quad cane. You can get ones with a large base or ones with a smaller base. Or then I kind of like best for most people, though, again, individualized, what's called the hurricane, which it's more of a tripod with a smaller base, but it gives a bigger base than just a single point cane would. And the nice thing about it is when you're done using it, you're sitting in the chair, it stands up on its own, so you don't have to worry about leaning it against something. In general, if you have concerns that you might need to use something for your walking, I'd have to say a therapist can be quite helpful with you picking one that's best for you and knowing which one is needed or if one is even needed at all. Any sort of walking device that you use should be adjusted to your height. General advice is that if you have a relaxed arm, you would want the walking device to hit at the wrist. But again, PTs, OTs can certainly be helpful with setting any sort of assistive device to the right height.
For oxygen tubing, it can get quite long and become a pretty big trip hazard. So some things that we recommend are placing bright colored tape every 12 inches or so at certain intervals, just so you know where it's at all times. When you're walking around, looping it so that, and kind of like pulling it out behind you as you go so that you're keeping track of where it's at and you have just enough slack. If you're not using a device to walk, you can hold the tube in your non-dominant hand so that your dominant hand is free to do what you need to do. And before you sit down, it's always good to know, where is my tubing at? Am I going to step on it? But I don't recommend that people like stand and untwist it. Like if it's twisted, sit down and untwist it. So just generally knowing where it's at and kind of making sure when you're walking with it, you can have it like along the wall and making sure it's not directly in your path. And again, if this is something that is kind of tough, it would be worth it to have a therapist come out that could give you more specific recommendations on placement and how to walk around and get around your specific house with it. Oh, wait, no, you are. Sorry.
Okay. So just general fall prevention ideas, doing exercise to help improve balance and increase leg strength. As a therapist, I would have to, obviously advocate for this. General recommendation is 150 minutes of light to moderate intensity activity a week and strengthening of all major muscle groups 2 times a week. Exercise can also help with confidence. As we mentioned, anxiety or fear of falling can be a risk factor for falls. So by exercising, you can help with the confidence factor. You can have a doctor or pharmacist review your medications. Some medications could make you sleepy or dizzy. If you're sleepy or you're dizzy, you're at a greater risk for falls. Having your eyes checked to make sure your vision is good. Glasses can be sometimes an easy fix to make your vision better. Getting up slowly, that ties into that postural or orthostatic hypotension idea. So if you get up slow after you're sitting or you're lying down, well, then you're less likely to have a fall because of passing out. That might be more important if you've noticed you get lightheaded and dizzy during those sorts of transitions. I mentioned specifically related to the stairs, wearing shoes both inside and outside the house. I know that might be controversial for some people, but just if falls really are a concern, considering wearing shoes inside the house, or a good compromise might be grip socks just to increase that traction. We talked about lighting a lot, using brighter light bulbs. LED bulbs are bright and they cost less to use than fluorescent bulbs. It's safest to have uniform lighting in a room. Anything that's dark, add lighting. Hang lightweight curtains, shades to reduce glare. The remainder of the presentation is devoted to what to do if you have a fall at home. So you've just fallen. First step is don't panic. Stay calm, remain positive, assess the situation. You're already down on the ground at this point, so the worst part is over. So it's just a matter of not making a bad situation worse. So once you get collected, then the next step is to think about, can I get up safely or can I not get up safely? And then this is a decision tree, you could say. If you say, yes, I can get up safely, then I've got some slides to talk about that in more detail. But in general, you'll want to roll onto your side and push up onto hands and knees. You'll want to find some stable furniture, and you'll want to tell somebody you've fallen and probably see your doctor. If you're on a blood thinner, if you take a medication that's blood thinning, a fall really is considered an emergency because there might be some internal bleeding or even a brain bleed that might go unrecognized. The other half of the tree is no, I've decided I really can't get up safely. I'm injured, I'm hurt. I just really didn't have good balance. So no, I really shouldn't try to get up. In that case, you're going to want to try to get somebody's attention. If you wear a personal alarm, good time to activate that if it hasn't activated itself already. Reaching for a phone, making a loud noise. I had once somebody fall outside and get attention using a car horn. So use what you have. You can use pillows, blankets. If you're going to be there a while, might as well make yourself at home. And then once help has arrived, this is the same step. You'll want to tell somebody, you'll want to see your doctor. So these diagrams show more specifically 2 different ways of getting up after a fall. So one option, especially if your knees aren't so great, is to rely primarily on your arms to get up. So to do that, you might start on your back, roll to your side, come up so that you're kind of on your hands and your bottom. And then you're going to prop yourself up with your arms behind you. You can maybe slide a cushion off of a chair with a cushion, use the arms to get up on that first cushion. You sit on that cushion and you try to slide to the back of it as far as possible until your back is against the chair or the couch. And then you can do one more lift with your arms onto the couch or the chair. And then you made it. Rest. Make sure you let somebody know that you had a fall. Another option, and this works a little better if your knees aren't highly painful or very weak. Starts out the exact same way. You're on your back, you roll onto your side, you come up kind of on the side of your hands and your bottom. But then from that position, you would go onto your hands and your knees. And then from that position, you can crawl toward furniture if needed. Then you'll want to get into this tall kneeling sort of position with your arms on the chair or the couch. Place your strongest leg forward. So if you know one is stronger or less painful or less arthritic, that's the one you'll want to lead with. And you use that leg and your arms to help you push to a stand. You turn around slowly, and then you have a seat. And again, you made it. Recover. Make sure you talk to people. So here's just a list of some references. We'll take questions. I do just want to show Noreen included a quite detailed resource list as well. So yeah, thank you for attending. And what questions do we have?
We were so thorough, they don't have any.
On the blood thinner, when you say that's an emergency, is that the emergency room or just an emergency call?
I mean, I'll repeat the question for the folks online. The question was, I said if you're on a blood thinner when you fall, that's considered an emergency because of the risk of internal bleeding, the risk of a brain bleed. I was asked, does that have to be the ER? I'd say definitely same day. You know, if you seem stable, I think you could start with your primary care provider. But if you're not hearing back or they just don't have room, then unfortunately it might need an ER, especially if there's concern for the head. Well, then there's going to want to take images of your head, and the best place to do that is the emergency room.
Yeah, I agree.
That was a really good question. We got another one?
Yes.
What do you do with your crutches and
Yeah, you want to take it or
The question,
repeat
the
it?
question was, what do you do with your walker or your crutches when you're done with them? And yeah, you definitely can donate them. Like I know several churches will do like loan closets. I think like Salvation Army too. Do you know any good places to donate? There's also, you could consider keeping it too, because it's not a bad thing to just have on hand if you, especially like a basic walker. It's not a bad thing to have on hand if you were to ever need it again, or even like family members. Do you know any off the top of your head?
Yeah. So I was just looking into this recently. I think the Nevada American Legion still has a loan closet. There's Easter Seals in Ankeny. I've heard some mixed things about Ames used to also have an American Legion loan closet, and maybe somebody can help me, but I've heard some things about that not really being up and running anymore, it being a COVID thing primarily that it shut down. But yeah, local American Legions and then Easter Seals in Des Moines. And yeah, remember, so insurance will only reimburse a walker every 5 years. So if the walker is less than 5 years old, I definitely hang on to it. I wouldn't give it up yet because you just never know. Also a really good question. Do we have other questions, either online or in the audience?
I'm going to ask a quick question. Shoot, now I lost it. Oh, I know. So, like, I know if you're in the hospital and you've had a health issue and you're going home, you may be able to get an OT or PT to come into your home to evaluate. And if you covered this, I apologize. Are there other options just to have somebody come in and help you make some of these adjustments and changes to your home?
That's a good question. I feel like Noreen might know something.
So usually after,
Oh,
yes.
yeah, repeat the question.
So basically, after a hospitalization, besides OT and PT or home health, like what are the other options for having someone in your home to make these changes? So if you're in the hospital, often upon discharge, you'll know whether the therapists in the hospital are recommending OT and PT in the home. So that's the first way we could come out and recommend what changes might need to be made in the home. Mary Greeley also does have like homemaker health aides. So you could be sent home with just some additional help for like bathing if needed. And we even have like personal care homemaker services that will come like once or twice, even a week, to do like laundry and vacuuming and that kind of thing. But if you're wanting like an assessment made about equipment or any like changes to your environment, that would probably better off being like a skilled therapist. And then of course we have home nurses as well that come in. So there are definite, or if you're wanting more support in the home outside of home health, there are things like Home Instead or help at home that you could, it's unfortunately insurance won't cover it, but you can pay out of pocket to have someone for help around the house, companionship, exercises even. If you learn a home exercise program, they can continue it with you. So there are plenty of options to get help in the home. It just kind of depends on doctor's orders, budget, your time, and what you want in terms of help in the home too.
Sure. Yeah, I'll say, like to get home health specifically, the hospital doesn't have to be the only source of those referrals. Like your doctor can refer to home health. Generally, to qualify for what we would call skilled home health services, which would be a nurse, therapists, to that effect. You have to be homebound, meaning you're leaving the home pretty darn infrequently. Depending on insurance, there are some insurance exceptions to this, but generally you would have to be homebound, but by condition. It's just too difficult to leave the home with whatever is going on.
Or you can leave the home, but need quite a bit of extra help from a caregiver in order to do that. And it's infrequent and a difficult and taxing effort. And if you don't meet those requirements, but still would need therapy, that's when you would consider outpatient. And again, your primary care provider could make that referral. And it's as straightforward as like, I feel like I'm having a harder time getting to and from my car. Is PT appropriate for me, kind of thing? And so just talking to your doctor about the new challenges that you've had, they're very good about making those referrals. So
Yeah. Yeah. So yeah, if you're homebound and there's been some sort of recent change, you definitely ask your doctor. It doesn't have to come through the hospital.
And Tim, why don't you go ahead and read the online question?
Okay, the online question is, which are the best floor strips to use, especially on tiles?
Best floor strips, especially on tiles. I don't know if I have brand recommendations.
I don't think I have a specific brand recommendation. Oops, sorry. Did I put it in here? General motion.
I think most of them say like to use on wood, plastic, what types of material, don't they?
Right. Vicki pointed out if you go to purchase something like that, the product might tell you. If I've bought them in the past or had people buy them, it's been on Amazon.
I've just recommended whatever, like the first thing that pops up on Amazon is. So if you guys have any feedback on ones that you like, let me know, and I will make sure to recommend it to the next person.
Any other questions here? No? Tim, let's ask Tim.
Tim, are there any other questions?
I don't know if you heard, you might be too soft. Tim, are there any other questions online?
Nope, that's it.
Okay. Do you have anything else to wrap up?
No,
All right.
thank you.
Yeah.
We're both passionate about reducing falls in the home. I guess it reduces our work a little bit, but that's okay. We'd rather people stay healthy and safe. So.
I always tell my patients when I discharge them, I hope I don't see you again.
Right.
Or maybe not in the home. I'm happy to see you in the community.
Yeah.
All right. Well, very good. Thank you, Noreen. Thank you, Kristen. Great information, great handouts, and this resource list is wonderful. Gosh, I grabbed my introduction, not my what I'm finishing up with, but. Thank you everyone for coming in. You will be next week getting a flyer in the mail with our November, December, and January programs in it. There's a couple coming up in November. In December, we have our holiday gathering. So our first one in 3 years out at the Gateway. So looking forward to it. As a reminder, most of our programs here that you come to at the Medical Center, you don't have to be a member, but for our holiday party, you do. So if you want to join us, and we always have a great time, make sure you get your membership renewed, or if you're not a member, join now for the first time and get all the wonderful benefits of membership. So thank you for everyone again for joining us, and stay safe in your home. Good job, ladies.